Good evening. I'm Sherry Day Scott, and on behalf of the entire PBA team, I wanted to say thank you and welcome to this evening's conversation, our second Did You Wash Your Hands Live conversation. This evening's discussion, led by Sam Whitehead, WABE's health reporter, will focus on COVID's impact on Atlanta, what we've seen in the past months, and what we can expect in the months ahead. But before we get into the conversation, I wanted to extend an extra special thank you to our supporters, to the people like you who show up for our conversations, who engage with our content, and who donate regularly at wabe.org. So thank you again, and please enjoy the conversation and know that you can, throughout the conversation, put your questions in the comments. And I'm going to kick it over to Sam because I know that's really why you're here. Sam?
Thank you so much, Sherry. And we'll dive in. It's Wednesday, October 6th, 2021. And this is Did You Wash Your Hands Live? We're a podcast from WABE answering the questions that everyone's asking during the COVID-19 pandemic. I'm health reporter Sam Whitehead. Today, at this point in the pandemic, more than a year and a half in, where are we going? What are the big challenges ahead? And is there anything we can be optimistic about? Those are just a few of the questions we'll dive into during tonight's event. And I can't think of a better set of panelists to help me do that, to help orient all of us after what's been a very, very difficult pandemic summer. First, let me introduce Dr. Lily Immergluck. She is a pediatric infectious diseases specialist at the Morehouse School of Medicine. She currently serves as the school's site principal investigator for its participation in the U.S. COVID-19 Prevention Network that includes the COVID-19 vaccine clinical trials. Dr. Immergluck, thank you so much for being here.
Thank you, Sam. It's a pleasure to be here.
Also with us is Dr. Audrey Arona. She is the District Health Director of the Gwinnett, Newton, and Rockdale County Health Departments, a job she's held since 2019. Prior to that, she worked as a consultant for the health district for a number of years. She has been an OB/GYN in private practice in Gwinnett for close to 2 decades. Dr. Arona, good as always to talk with you. Thanks for being here.
No, thank you, Sam. I'm delighted to be here, and thanks for the invitation.
So before we dive in, I want to set the scene a little bit for our audience just by talking about some of the latest figures, right? This is a pandemic, and there's a lot of different ways to slice and dice it, but I think looking at the numbers is a good way to orient us as we talk. So according to the latest state data, the rolling average of newly confirmed COVID-19 cases is now down considerably from a peak in late August. We're now at levels below the peak that we saw in summer of 2020. When it comes to hospitalizations, those are also down. They've been declining for some time. COVID-19 patients make up about 17% of all patients in Georgia hospitals. At the same time, 88% of all ICU beds in the state are full. When it comes to vaccines, only 48% of Georgians are fully vaccinated. When we think about how many people live in the state, that leaves more than 5 million people who haven't completed a vaccine series. So those are some of the numbers. And I'll start with you, Dr. Immergluck. If you want to take those numbers and kind of pull out how you feel about where we are with this pandemic right now, how would you do that?
Well, for me, I think it's looking at the community level, what's happening in terms of community transmission. And so like you, I follow these numbers closely. And as we roll through this last surge, as a pediatrician, actually, I was very paying attention because I realized that many of our children are not eligible for vaccination and school was about starting. So that was troubling. And so as we go through and try to understand what's happening in our country at the county level, at the community level, I'm asking myself, what can I do to help get that messaging right so that we continue to go downward in terms of our trends, in terms of cases of disease, hospitalizations, and of course deaths. But again, my focus lately has been on the children.
And Dr. Arona, I mean, it's been a difficult summer. We're a few weeks into fall. I think going into the summer, a lot of us were maybe pretty optimistic that things were moving in a better direction. Then, at least in the Southeast, the Delta surge came and kind of swamped us. That has been declining now for the last few weeks. So how do you what do you make of the moment that we're in right now?
Well, you're right. I mean, we absolutely suffered probably our worst wave and our fourth wave, which, really no one predicted it. It really wasn't surprising because, until you get enough people vaccinated to prevent the variants from occurring or at least being able to take over in terms of spread, it really was anticipated that this would happen. I think we all didn't, we're hoping that it wouldn't. But that's the thing, like you said, only 48% of Georgia is vaccinated, but that's the overall population. If you look at even the eligible population for vaccination, which is 12 and over, that's 55% are fully vaccinated in the state of Georgia. But that's still a far cry from herd immunity or what anybody would consider herd immunity, since it's a definition that a lot of people have different opinions of.
Well, sure. And to maybe think about vaccines a little bit, I certainly have had a lot of conversations in the last few weeks about where we are with booster doses. Currently there is only one booster that's been given the green light by federal regulators. This is for people who have gotten a primary series of the Pfizer vaccine, who work in, say, high-risk conditions in healthcare, teachers, people who are 65 and older, people with underlying health conditions. What do y'all make about where we are with boosters right now? Maybe let me start with you, Dr. Arona. How is that rollout going in Gwinnett, Newton, and Rockdale, these counties that you're working in? And do you think that there's a really good understanding on the ground by your everyday person about the need for boosters and then who actually needs them?
Right. Those are some really great questions, Sam. And, we anticipated a much larger rush for boosters than we actually, realized. We've done in the last 2 weeks, which since it's been available, we've done only roughly about 1,000 boosters, and we anticipated 1,000 a day. We were hoping for that. But again, it's just Pfizer. I think there's a lot of questions, about that and then the others. And I know that later this month, next week, as a matter of fact, 14th and 15th, the FDA will be looking at Moderna boosters. The next day, they'll be looking at Johnson & Johnson boosters. For children, we get to see, the FDA committee meet about that on October 26th. So there's a lot in the future that's about to change about boosters. And I think, when you look at the vaccinated population that's being infected with COVID, it's mostly that elderly population. Over 60% in Georgia of the vaccinated infections with COVID are in that age group. And remember, they were the first ones to pretty much get vaccinated. So I think that points to the booster maybe being a really good idea, especially for them right now. And I think others may not feel that pressure and need for it so soon because they were vaccinated later.
Well, sure. And Dr. Immergluck, I'll direct this to you. I mean, you said this last surge, which has really had an outsized impact on children, especially those who are too young to be vaccinated, has really got you thinking about the impact of this pandemic on children. What do you make of the fact that we're already giving third shots to some adults and we have not a vaccine that's available for kids under 12?
Well, let me just say that point, the answer to that question emphasizes the reason why we should be encouraging vaccinations and continuing to do so. When people ask me, why should we get a booster? Why do I get vaccinated if I have to get a booster now? And what I want to say to them is, look, there's still a significant number of the population who are not even eligible to get vaccinated. So what we understand, and I don't know if this is clear to the general public, but these vaccines were never intended to prevent disease entirely. They were intended, when they looked at the clinical trials and the efficacy of how well these vaccines worked, they were intended to prevent moderate to severe disease, get you in the hospital, or in death. It's done that. But what we now see, if you look at the population that's being affected, that curve of those who are most impacted by moderate and severe disease, it's moving downward because the older population, they have some immunity. It's waning. That's not surprising. So I want to emphasize that's the reason to get the booster among the priority groups that have been outlined by you and by CDC. And hopefully by us getting the booster, we're protecting the people who aren't even eligible to get the vaccine.
And we've seen that again and again, just thinking about schools over the course of the pandemic. Researchers at the CDC, for instance, have put out report after report that show the higher a vaccination rate in, say, a community, the more protected, say, kids are who aren't eligible for vaccines. So that kind of knock-on effect that you're talking about. Speaking a little bit more about vaccines, Dr. Arona, I think you have what I would imagine would be a challenging job just working in one county, but you're actually responsible for public health in 3 counties that are actually quite different. Demographically, if we want to think about, socioeconomically. And I was looking at the vaccination numbers today for your 3 counties. The vaccination rate is higher in Gwinnett than it is in Rockdale. It's higher in Rockdale than it is in Newton. So how do you approach something like this vaccine rollout in these 3 counties that are so different?
Right. And that's a great question, Sam. First of all, our district is the largest in Georgia. Because, and Gwinnett really represents a metro county, which is, they're very similar. All the metro counties are very similar within a point or two of vaccination rates. The more rural that a county is, the less or the more hesitant people are about the vaccine. And so what I found most important is to be present. I've really had to be present and listen because, every community, even within a diverse county or a more rural county versus a more populated one, I mean, you just have to hear what the issues are and address them. We have a pandemic of misinformation, Sam. I mean, it's really, and disinformation too. Misinformation is just inaccurate, and disinformation kind of is inaccurate with an agenda, behind it pretty much. And so it's really, really important to convey the truth, educate people, answer their questions, individual questions. And even within, the rural populations in the counties, there are some populations that are more concerned about their immigration status and documentation for these vaccines and what's being tracked. And then there's others that are more distrustful of government. And so you really have to be there to listen. And that's what we've been trying to do to address our issues.
And just to follow up, if I could, I mean, that's a lot, sounds like a lot of work. I mean, anybody who has ever been involved in, any kind of project that tries to turn to the community for input, that can mean hours and hours of meetings, collecting lots of opinions. Do you have the workforce to do that effectively while also, say, still trying to provide testing, still trying to do contact tracing, and then all the other non-COVID stuff that y'all do at Public Health?
Absolutely. Well, staffing has been a challenge. And like I've told everyone from the beginning, it's a new prayer every day. But what we've tried to do essentially is, I'm fortunate because I have a public health workforce that is extremely dedicated to the communities that we serve. And they have just put in hours and hours and hours of overtime, and everybody is extremely exhausted. But we do try, to do in little ways or what ways that we can to encourage them. And, we really celebrate the wins. Every time a percent increase in Georgia, that's 10 to 40,000 people, right? Mm-hmm. So, I mean, that's a win for us. And so, these small incremental things, are important. And so again, we just have to do that. I give my cell phone number out to every single person at every presentation that I give. And because it's really important, if people have questions or don't know where to turn for information, they need to have a source to do so. So I think just being present has made a big difference.
Well, sure. And to maybe dig into what you mentioned about misinformation and disinformation, I mean, Dr. Immergluck, what are the kind of big things that you've seen and heard out there in the world when it comes to either disinformation or misinformation that really kind of get your hackles up? Things that you've maybe had someone say to you in a social setting, or something you've seen on social media that you think is particularly harmful if we want to think about the vaccine rollout. And then maybe not just to highlight it, but then, correct that misperception for us, if you could.
Yeah. So actually being at Morehouse School of Medicine, where our institution is known for the community engagement with our community members, not just around Atlanta, but in other different settings, we have really been all hands on deck to try to tackle the misinformation. The longstanding distrust about clinical research around the vaccine trial unit has really come through in terms of the conversations we've had in different settings. I mean, not just me, but there are so many people that are my colleagues, our dean president. We do so many different talks and sessions like this, or just in community events, faith-based organizations. But I say that to say that different groups have different reasons for the distress. And like Dr. Arona said, you can't just blanket say it's good to get the vaccine. You have to listen and understand what it is that really makes them hesitant. As I'm going to draw back again on pediatrician, because the whole issue about vaccine hesitancy is a long-standing topic that I have had to deal with, for my entire professional career. So the point of sharing that is that you have to, again, think about what's the audience, who's their trusted source. and talk with their trusted source. So we have a vaccine trial study right now that's targeting younger folks, 18 to 29-year-olds. And if you look across the nation, not just in Georgia, it's true everywhere, that age group is a tough one. They, from information that was shared at the beginning of the pandemic, they felt like, maybe they were not resistant to it, but they felt like it's okay if they got COVID. And so addressing that and their fears about the vaccine itself, has been a tough one to address. But we've done it because we've gotten people that's on our team that have created social media platforms that actually resonate. Okay. And we've created different ways to reach out to that particular age group. So that's an example of some of the how we address some of the misinformation. I can go on. Yeah, go ahead.
Well, no, and if I can jump in here, this is I think moving in a direction I was hoping we could go. So we're talking during a week that the announcement was made that Dr. Francis Collins is going to be stepping down from leading the National Institutes of Health. And he, over the course of the pandemic, has been a very vocal critic of how the response has been politicized. He has said that has cost American lives. I would open this up to either of y'all, maybe Dr. Arona, if you would care to reflect on this. What do you make of that assessment? And I think more importantly, what can be done about it at this point when it seems like every aspect of our lives has been politicized, but this is one that actually really does, have lives at stake?
Well, I'll certainly jump in first. There is no question that, politics has influenced the COVID response and also influenced people's decision for or against the vaccine, without a doubt. So it's been really detrimental, and it's a shame, actually. Individuals themselves are actually viewing COVID through a political lens a lot of times, and especially, throughout the whole pandemic. But I think what's really important to understand are that political voices in a pandemic like this are really important, because they do, declare public health emergencies. They do, influence funding, things like that. But, I think when they step in and start talking about medicine in general, from a politician view, I think it's just it's just not right. And I wish that, we could actually remove politics incredibly remove it from the whole pandemic. And it's like Dr. Immergluck was saying, people trust their doctors, they trust medical voices a lot of times, they trust their faith leaders, they trust their community partners. And I think that, the way to fix this is really for people, when they're making decisions about the vaccine, to remove politics from their decision. I think that's really important. And unfortunately, it's going to require an individual focus to do that. If you look at September 11, if you just give me a minute to reflect on that, we had an enemy, right? The enemy attacked the United States, and the United States people just flocked together to fight this enemy. And, right now, the enemy with the pandemic is not you and me. It's not the people. It's the enemy is the virus. And if we can all just come together and fight this enemy, we could handle this. We could end this pandemic in a heartbeat if we would just do that. And I'm not saying you have to step up and get vaccinated. That would be my preference. But just, do your part. If you don't want to get vaccinated, then do your part to stop the spread of this, because we know clearly what is needed to stop that. And so I think that's the only way, is when it's at an individual level and we decide individually, to remove politics from this. And, I think that's the only way to look at it.
And yeah, Dr. Immergluck, do you have thoughts?
I echo everything she said. And let me just say also that, look at the science and the data. When I hear people bring in these misinformation. I think, look at the science. Look at what other countries have vaccinated and what's happening there. Okay. Science and data should drive this conversation. Watching the community transmissions as a result of some of the implementation of the science and the medicine that we've come being a well-resourced country. Vaccinations do save lives. I mean, historically, you can look at all these different examples of where vaccines that were developed, given to our children. You know, I people have heard me say this before, but I give this lecture to the medical students about immunizations. And I talk about diseases they don't even know about except to read it in a book, because they don't exist anymore. Why? Because we've achieved beyond that herd immunity for some of these diseases, these germs. The same holds true here. And so let us not bring politics into it. Let us just look at how do we address this public health emergency and pull our resources together to do that.
And thinking about, that particular example, diseases that students don't know about because they've been vaccinated against them, that makes me think about kind of the undercurrents of vaccine hesitancy that we saw prior to the pandemic. A lot of that attention really was focused on childhood vaccinations. We don't currently have a vaccine for COVID authorized for children under 12. Dr. Immergluck, I'm wondering what you're expecting to happen when we get there. Can we expect to see the same kinds of hesitancy that we've seen in adults when it comes to getting their kids vaccinated, understanding that there is decades of resistance to vaccination in children?
Yes. So, first let me tell the audience here that the way these vaccines are being developed and rolled out for the younger age group, there's no cutting corners. It's following the same method and process that we have done for decades for the other vaccines to eliminate those childhood diseases I talked about earlier. Okay, so we're going in a stepwise manner. We always start with, the older adolescents, and we roll it on down. Okay, mm-hmm. There are currently trials right now for 6 months and up. People are not necessarily aware of that. So I don't want it to be like, oh, all of a sudden it's okay to give it to our younger age groups. It's because they're already in trials. Okay, and so that's important to communicate. I'm expecting that we will see hesitancy among our parents. I think early on in the pandemic, people felt like the children were not necessarily immune, but they just didn't get sick. They didn't see disease, but that's because the overall transmission, the community level was so low. Mm-hmm. Now we've got all these people, the adults, the older adults vaccinated, so they have some antibody protection. And so who's the virus going to look at? The people who don't have antibodies. And so if you look at the data on CDC's website or whatever dashboard you want to choose, you're going to see that the peaks are actually happening on the younger age groups. So our pediatric hospitals have many more COVID infections. We have many more cases. Still, knock on wood, we don't see that many deaths. But still, there are consequences of kids getting infected. And if you look at the data, I would encourage people to go to the American Academy of Pediatrics website, because that data is summarized very succinctly. You can see that the numbers are dramatically high in the month of September. It's huge numbers compared to what we saw even last summer.
And Dr. Arona, I'm wondering, from your perspective as, a public health leader who is really wants to, I'm sure, see as many children in your district vaccinated as possible, we can expect we're going to get a vaccine at some point. So for this age group, so what work are y'all already doing now to go ahead and try to build that runway to make sure that parents are aware and that they're actually interested in taking advantage of this vaccine when it's available for their kids?
Right. Well, if there was anything good that came out of Delta, it might be that the awareness that COVID could actually affect children is very apparent now. And so I think, parents who say, well, I can get sick and I'll be fine and all that, but nobody wants their child to get sick. So, again, we tend to be more protective over our children than even ourselves oftentimes. But, this is a race of the V's. I've said that a million times. Vaccine versus variant. And in April, May, June, the vaccines were winning, right? But then comes Delta, and boy, now, we really were losing ground there, right? And so again, once the children 5 to 11-year-olds are eligible, that's going to give us actually more of our population to get these antibodies on board. And I would really hope and encourage parents, to get their children vaccinated. If you look at the flu vaccine, more children are vaccinated than adults are. There's 68% of children in the 2019-20 flu season, over 68% of children that got vaccinated from 6 months to 17 years old, only 48% of adults. And so, I hope that happens here too, because again, they're going to be more. And the great thing about this is that you can get a flu shot and a COVID shot at the same time. So hopefully we'll be having the eligibility for that age group come about pretty quick, and then we'll be administering both. And I think part of the reason why there's more vaccines for flu in that age group is because that age group tends to see the doctors more often than adults do. And so that may be why, because the more visits you have with a medical professional, the more likely you're going to get pushed to or educated about the flu vaccine. So.
And to maybe pull this out a little bit more, I'm curious what each of you think this conversation about vaccination, specifically in children, is going to look like 5-10 years from now. I'm of an age where, the HPV vaccine was released when I, was a teenager, about the time that it was recommended for me, but it was still a very new vaccine. I remember at the time, it was kind of family to family, a decision about whether or not they were going to use, to get their kid vaccinated. Certainly, we're in a pandemic, the situation is a little bit different, but it seems like a decade on, 15 years on, the conversation around the HPV vaccine, all the, intensity around it has kind of gone away. Are we going to see that with COVID-19 vaccination 5-10 years from now, thinking about kids? And can we wait that long for the temperature to really cool down?
Well, I'm hoping that that's the way it's going to lay out, because I don't think this, although I am, we'll be over the pandemic, I think coronavirus, which is the template from which this novel coronavirus is developed, will still be here. And I think, we're going to move from epidemic to an endemic situation. And so that we will be having a COVID vaccine that's part of the repertoire of vaccines that we have to give ourselves at some interval.
I agree with that. And absolutely. And I'm hoping that we actually even have a flu/COVID annual vaccine. I can kind of see that. That's my prediction for whatever that's worth. But it's not like measles or chickenpox, where if you get that disease and you have this lasting immunity, it's a mutatable virus, just like influenza is. And so therefore, there's going to be variants. We just, we'll have to adjust to that as we go forward.
And so that, to me, again, I want people to recognize it is that race of the V's. I mean, we want to drive the transmission levels of this virus low enough. And the only way to do that is to take it out of circulation so it's not able to mutate. And as long as we have people that are susceptible, it's going to allow more variations to occur in the genetics of this virus, because that's what this virus inherently does. So I just want to emphasize, for people to understand that. I understand the issue about personal choice and why that's important. But, community, do what's right for everybody. Do what's right for your children. Decrease the community transmission of this virus in its current state, and then we will not have to worry about the Delta, the next variation of the Delta, which may be even more transmissible than what we are currently seeing with Delta.
And thinking about those communities, there are distinct segments of them that bring people together in ways. I'm thinking, Dr. Rona, about the Gwinnett County Public Schools, the largest district in the state, serving some 179,000 students. It's like bigger than some cities in Georgia. It's mind blowing how big the school district is. School has been back for a few months now. We saw a big spike at the start of the year that started to calm down a little bit. Watching the situation play out in Gwinnett County has made me really curious what your agency's relationship is with the school district. Because I think one of the things that's complicated the response to the pandemic is you have different entities, say school districts, public health departments, local governments, all trying to tackle this problem. And maybe, to mix the metaphors, those puzzle pieces don't always fit very well together. So what is your relationship with the school district like, and how have things been going, per your assessment up there?
Well, I'm so glad you asked that question because, Gwinnett County's relationships with community partners is so rich. And it's one of the things that I feel so blessed about our district is that even in our rural counties, we have the most amazing partnerships with nonprofits and foundations and city and county and, officials and legislators, and everyone is really together a lot on especially issues like this that really affect much of the community. And we model that for the entire nation, and others have asked us about that. It's not a new relationship for Gwinnett County Public Schools and public health. We have had this rich relationship for years, and it's very important because we have outbreaks in the schools all the time, and we guide them. We never make decisions for the school district, but they always look to us for guidance and education and good information and accurate information, which we're so happy to engage with. We help them with problems. They help us with issues too. And that's really been great. And I think you'll see the numbers, how really well the public system here in Gwinnett County has had with, the students. It was really important when they were virtual, when all these decisions were being made that way too. And even over the summer, we started the plans for this fall way back in the summer, and we worked with the school system throughout the summer really to try to find ways to get that 12 and older group vaccinated, even to the point where we were talking about relationships with the athletic directors and coaches, and because we realized that student athletes are oftentimes role models for other students within the school. So we thought, well, let's leverage that and really try to get them to, be good role models about vaccinations where other kids will want to do the same. Just an example.
Yeah, no, that's great. And I want to just pause here for a moment. We've gotten a few questions in, but for everyone who is watching this live, we do have two very intelligent people here who can take and answer your questions. So if you want to put those in the comments section, we're going to go ahead and start to dive into those. We'd love to hear your questions, your concerns. This is meant to be something for you, our community. And I want to go ahead and start with one of these, and I will direct this to Dr. Immergluck. Dr. Rona, you can weigh in if you want to, but once you see the question, you can make that decision. So, Gwinnett County Schools has required masks. That has not been the case for other Metro Atlanta districts. We have a question from someone about Cobb County. For a little bit of background, the Cobb County School District does not have a mask requirement. Maybe about a month or so ago, the Board of Health for Cobb and Douglas County actually issued a formal resolution calling on all schools in Cobb to have masks. The district itself, the public school district in Cobb, has still not put that in place. So Dr. Immergluck, for say a parent who is in that kind of situation, they have kids in schools, maybe the public schools, maybe they're not happy with what, the kinds of prevention measures that their public school has in place. What would you recommend they do to keep their kids safe?
So That's a really good question. And I'll say that, sometimes I think that it's challenging to navigate through the CDC's websites. And there's like so much good information there, but sometimes I think for parents and teachers and even healthcare workers, it's hard to find like where all the information. But one of the things that resonates across many of the pages is kind of what we call layered COVID-19 prevention. And I say that because layered means there are many layers, approaches that you kind of fit to a particular situation. So part of that is the masking, okay, vaccination, ventilation, and it lines it up. And I bring this up because I see this discrepancy interpretation of what is, when should we mask mandate, and when, or if there is masking, how safe is it for my child to return into the in-person learning? Because that's where many parents, maybe I'll say most parents, want to be at this point. Mm-hmm. And I'm going to go back to saying parents have to pay attention. What is our community transmission looking like? If you live in an area of high transmission, the likelihood that your child will encounter somebody who may be asymptomatic or mildly infected with COVID is much higher, right? And so CDC's made it out simple, colors, even the Georgia Department of Public Health, you can look at for your county. So community transmission should drive this conversation for parents to understand, and then be advocates of this layered approach. I'm a pediatrician and a healthcare worker that sees some of the consequences of having COVID infection that could have been prevented. So to me, the simple masking, if you look at what the American Academy of Pediatrics has stated, what CDC has stated, it states very clearly that if you're 2 and up and you're in a high transmission level, and we are all right now still in that considered high category, masking is necessary. It's basic common sense. It's not about political. It's a personal choice that masking works because it prevents the transmission of respiratory viral particles, whether it's COVID, whether it's flu, any of those germs. So I can't emphasize that enough as far as that particular layer. The other parts, vaccination. If you have, high percentages of your staff, the faculty, the people that are eligible for vaccines that are actually vaccinated, then you got that layered down. But it's a multi-pronged approach, and people have to be cognizant of that and implement that based on their particular school system.
And Dr. Arona, I'm not, you can weigh in on the situation in Cobb if you want to, but I think that this particular kind of disagreement, we'll say, between the school district and between the public health department highlights the limitations that are put upon every public health official in your position. I mean, even all the way up to the CDC, they're not a regulatory body. They can't put rules in place. All they can do is make recommendations. And it's up to, elected officials to take those recommendations and, turn them into rules and policy. I would imagine that is often frustrating, that, your ability to, say, influence personal behavior can only go so far. How do you navigate that when there is something that does prevent such a present threat to the community that it's your charge to take care of?
Well, you're right. It is very frustrating at times, sometimes more than others. But I look at it as opportunity for education. I mean, I just really, much like Dr. Immergluck said, these layered prevention strategies are really important. But what I say to parents, and especially even in Cobb County, and I say it in Gwinnett all the time and my other counties, is that, look, once the child leaves the school, they're in your hands. So, all these protective measures against COVID are equally important at home as they are in the school system. And, even if there isn't a mask mandate, you can send your child to school with a mask, right? It's optional. And so, again, I think we as humans, initially when the pandemic first came out, we really needed to shut down things and to get everyone's attention and provide education because we had this emergency. But do we really need that as a society now? Do we really need that, as opposed to just knowing individually how to keep ourselves and our families safe and our community safe? I'm not really sure we do need those mandates, right?
The issue for me is just the interpretation, and where people get their information, and that misinformation. That's one of the things that to me is so frustrating, because the guidance, and the interpretation of that guidance seems to change, and for parents and for lay folks, it's hard to keep up. And so I think they defer to people they think, oh, they should know, right? But if we're not giving a consistent message in that, and we're saying, oh, it's not required, well, then if I'm struggling with my child to put that mask on, and I think, oh, it's not required, well, they would know. They wouldn't want me to put my child in harm's way. Then I'm just going to default to do the, okay, if it doesn't work. What I'm saying to that's the wrong interpretation. That's the wrong interpretation.
Right. No, I think education and the promoting of accurate information couldn't be, more important than it ever is now. I think also that, like you said earlier, there's a lot of common sense, a lot of common sense in this. And I think if we look at this as an enemy, and we've got to protect ourselves from this enemy, and we got to protect our community and our extended families and all of this. It's not a really hard, the only way out of this pandemic right now is vaccination. Natural immunity is just not enough. It's not. And, we really need, it's interesting because, Sam, the pandemic started with our elderly population at most risk, right? Well, now it's up to that younger group, like Dr. Immergluck was talking about, where, the 18 to 40-year-olds really need to step up and get vaccinated. That's the group, right? So I challenge that age group really, if, make a difference in our world and really help, stop this pandemic by stepping up and getting vaccinated.
And Dr. Arona, you mentioned the way out. We are 18, 19 months into living through this pandemic. And I think a lot of people are now, as they have at many other points in time over the course of this pandemic, really are wondering where things go from here, what the end looks like, and how we know when we're there. I'm curious, and I'll let each of y'all take a crack at this one. I mean, what does the next 6 months to a year look like if we want to think about the pandemic in Georgia? Maybe Dr. Immergluck will start.
Okay.
I thought you were going to go to Dr. Arona.
Oh yeah. Dr. Arona, go for it if you've got thoughts.
Well, again, it is not too late to get vaccinated. It's really not. And I struggle every week to try to think outside the box and think, what kind of message can we really give that will really help a lot of people go, I get it. Because to me, and I'm sure to Dr. Immergluck, this is just so easy to understand. It's like, why don't you get this, that, we could stop this vaccine tomorrow. If everybody just went out, there's ample amount of vaccine, right? I mean, we have mobile clinics in every part of our counties that you can imagine. You can walk in anywhere. There's no lines. There's nothing. I mean, it is readily available. And all we need is for the, people. I mean, anti-vaxxers will never get vaccinated. And that's okay, because herd immunity, the rest of us can cover that. But those that are on the fence, it's like, just get off the fence and get vaccinated and really make a difference. Our whole world would change.
Well, yeah, and so maybe that's answers another question I was going to ask, which is kind of maybe what our biggest challenge is ahead. But if that is still kind of the biggest challenge and the way out, Dr. Rona, I mean, where are we going to be 6 months to a year from now?
Right. And, what I'm mostly concerned about right now, my biggest challenge is flu coming up. Okay. We're already seeing more flu cases now than we ever did last year. And that's because last year, I mean, that should be the pure testimony of how well these layered prevention measures, all this masking and hand washing and, staying home when you're sick and all that really makes a difference, right, to all of our diseases, including influenza. We did not have a flu season last year, and this year we will. We are seeing that already. And like you started out the podcast with, our hospitals are really in trouble. I mean, we are over capacity in the hospitals, understaffed. Our healthcare workers are exhausted. And, we as citizens really need to help them and help them by not creating this flu season, monster that has potential this year, right? So, step up, get a flu vaccine at the same time you get your COVID vaccine, and we'll be there. But that's the biggest challenge I see in the near future, at least.
Yeah. How about you, Dr. Immergluck? I mean, maybe we'll start there. Biggest challenge ahead, and how do we address that?
Well, I'm hoping in 6 months that we will have a vaccine that's FDA, EUA approved for younger population, which, kids make up 22% of the U.S. population. So it's significant. I hope we can really make a dent on having all this misinformation. Let's be unified on the message that we're communicating, no matter what forum we're in. I look at Morehouse School of Medicine. We're one of 4 HBCUs in the country. And you think about all the disparities that have been shown with COVID. And we have, mandated vaccinations. So right now, all of our staff, faculty, and students are 100% vaccinated. Okay. We have surveillance testing. So because we recognize that with COVID and the Delta variant, you may be asymptomatic, but you can still transmit, right? Even though the transmission is not going to be maybe as long or in terms of who's going to get infected, but people have people in their households, in their communities who are at risk. So we want to continue with that surveillance testing. We have mechanisms for contact tracing. So we have that layered protection in place. We're back to in-person learning. We're back to all of our staff. Our vaccine trial unit is very busy. Our clinical forums are busy. Because why? We can do that because we have that layered protection that I mentioned earlier. Mitigation strategies, we're looking at ventilation, all of those things. It works. And just to pivot on the flu issue, flu vaccinations, I mean, I can't emphasize that enough. And if people are on the fence about COVID vaccine, get the flu vaccine for sure. That's tried and tested, right? So, and if you look at, like Dr. Rona said, last season we had 1 pediatric death, in across the country. Looking at what's happening now, we aren't seeing that. Why? Because we have broken down that prevention strategy with that layered protection, right? So the masking is not consistently done. Our in-person situation is now different. So we have to take these lessons learned from the previous 18 months and figure out a way to go forward for the next 6 months.
Yeah, and just a reminder to folks, we are taking questions from the audience. If you have any questions, please submit them in the comments below. We'll try to get to as many of these as we can. I think conversations like the kind we have on this podcast every week tend not to be very cheery. This is a very serious, grave situation. Just this week we crossed 700,000 deaths confirmed from COVID-19 in the country. That's likely an undercount if we want to think about, the secondary and tertiary deaths that have been caused by this pandemic. So this is often a very serious kind of grave show, but I'm wondering for each of y'all, where we are now, what we've learned over the last 18 months, maybe even where we're going, is there anything that gives you kind of any optimism about our current situation, maybe something you think that we've learned as a country, as a community, maybe something that you hope we can take forward into the future?
Well, I'm a OBGYN doctor prior to my role here at the health department. And I can tell you that I think families are closer now than they used to be before. There is truly a lot more mental health and different things, that everyone is battling. But I do think that sometimes our priorities need to be straightened. And I think this pandemic has prioritized a lot of and straightened out people's priorities a little bit better. So the reason I said I'm an obstetrician, so I really think that our birth rate will increase, which will be good. So that's always a blessing to me. But even though, and again, I would encourage women who are pregnant or about to be pregnant or are thinking about pregnancy, please, please, please get vaccinated. It is very clear to the American College of OBGYN, the Maternal Fetal Specialists of America. I mean, every single OBGYN doctor that I know is really pushing this, because the effects of COVID on a pregnancy, not only to the mother, but the newborn, is really devastating a lot of times. And so we really need to be aware of that. There have been no issues with the vaccine at all in pregnancy or breastfeeding women. And we also know that the baby is protected from the mother's antibodies as well. So again, I would push that. But I'm encouraged. I think that there are opportunities always with challenges, and I think we've got a lot of opportunities. I really believe in the millennials and the Gen Zs, I guess we call them now. And I think what really interests me when you look back at the great pandemic, the influenza pandemic, there were a lot of similar problems that we had then that over these years never got resolved. Okay. And so I'm hoping that what comes out of this is that a lot of really great thinkers like yourself, Sam, will really think of some really great ways of ways that we can learn, so that the next pandemic going forward, is different because of this.
How about you, Dr. Immergluck?
Well, I think in terms of lessons learned, and that's positive, I do think that there's a place for remote working. I've talked to many friends and colleagues, and just hearing different things that I think it set a new tone in terms of the efficiency and effectiveness that we can do with our workspace. And I'm hoping that from this conversation that has been ongoing, that people see the importance of our public health infrastructure and pour resources and develop them, and look at how to standardize and make equitable across different communities that those kind of public health infrastructure. I have seen in the last few weeks 3 different states at the county level, 3 different standards in terms of the public health, and it's because of the resources that are either not there or there. And that's impacted the contact tracing, their surveillance that they can do. So I'm hoping that if nothing else, this is going to boost that up. And the last piece, that as a pediatrician and as a primary care provider, I see a place for telehealth. I think that is a whole form that we never really tapped into. But I see that that's a way forward to help families, especially in terms of being able to access care, okay, but in ways that they previously had not been able to.
And just as we start to wrap things up, I have talked to dozens and dozens of people on this podcast over the years, and a question that I like to ask people is what does the end look like, and how will we know we're there? there's going to be a day where each one of us wakes up and we realize we haven't thought about the pandemic in a week, and we'll be like, oh well, this is over. So I'm wondering for each of y'all, what does the end look like, and really, what signals are you looking for that will show you that we're there?
I'm going to be looking at the vaccination rates for the different age groups. We talked very early on about what does that target herd immunity look like, and I think that's where I think that's going to be a telltale sign as far as waking up and then realizing, oh, I could travel to this place without worrying as much because I know that the community transmissions are going to be low across no matter what community I'm entering into. Mm-hmm. So that's one of the things I'm hoping I wake up to.
How about you, Dr. Arona?
I could not agree with that more. I was going to say the same thing. Those vaccination rates, even though they're creeping up, boy, we watch them every day, don't we? And I just celebrate every time we get 1 percentage point up. The other thing is that I look forward to the day when this vaccine is in the hands of medical providers across the board. I think it needs to be treated like a vaccine preventable disease, like every other vaccine preventable disease. And I think that will be a marker of politics being less involved, which will be a good thing. But I think that will kind of coincide, I hope, with what you were talking about too, Dr. Immergluck.
Well, sure. And it seems maybe, Dr. Arona, what you're painting a picture of, and I'm really curious to see if this is what actually materializes, is, it seems like one day COVID-19 is just going to be kind of part of our lives in the same way that the flu is, or any other kind of transmissible disease. People, I'm sure there are still people living who remember living through the 1918 influenza pandemic. We will be all those people, many years from now when youngins say, oh, well, I go get my COVID vaccine. And we'll say, oh, well, do you remember? Yeah. I think we will end things there. First, thanks again to Drs. Immergluck and Arona for joining me this evening and sharing their thoughts on this moment in the pandemic. This podcast and these events are only possible because I can get intelligent people like each of you to speak with me. So truly, thank you for giving me this time this evening. Thanks also to everyone who joined remotely for this event. The hope is that one day we'll all be able to get together and do this safely in person. That was our plan before Delta, but those plans were undone. Did You Wash Your Hands is a production of 90.1 WABE Atlanta, where ATL meets NPR. WABE's managing editor is Alex Helmick, and Scott Wolfel is our chief content officer. You can reach me and this podcast at washyourhands@wabe.org. Now, we have over 170 episodes that we've done since March of 2020. You can find them all in your favorite podcast app. They're all there for free. That's also where you can leave us a rating and a review. That really helps other people find the show. And of course, if you haven't already, now might be a good time to go wash your hands. I'm Sam Whitehead. Thank you all so much for tuning in. Have a good evening.
Thank you.
Bye everyone.